Thanks again, Dr. Marissa Boeck, for talking to the Op Report. You are in Santa Cruz, Bolivia, where the Pan American Trauma Congress just ended. Tell us about that.
Yeah, it was incredible. It lasted basically from November 10th to November 14th here in Santa Cruz de la Sierra, Bolivia. It was the first time that the Pan American Trauma Congress has ever been in Bolivia in its almost 30 years of operation. And it was the biggest trauma, or any Congress, I think, in general, that they've had here in Bolivia. And it experts from around the world on trauma, emergency surgery, and intensive care because the society has grown to include all of that. And it also tries to attract people, not only surgeons, but also medical doctors that work in the emergency room and attend to trauma patients, also nurses, medical students, residents. We tried to get everybody who works on the team to take care of trauma patients to come to this Congress because there was something for everyone.
And you said there was worldwide participation. It wasn't just limited to Latin American countries?
No, I mean, really, they say they're the Pan American Trauma Society, which involves, way up from Canada all the way down south to the tip of Argentina. But there were people that had come from, I think, Ghana. Someone had come from Sweden, others from Europe as well. I'm trying to think if anybody had come from Asia. I don't have off the top of my head. And then a lot of people from South America, from Latin America in general, South and Central America, and also the United States. And I think so this was the first time I had ever been to the Pan American Trauma Congress. I became involved in the society a year and a half ago when I started working on the trauma registry here, which is using their model. And it was so inspiring and incredible to have such access to these worldwide experts in trauma care that do go to the other society meetings, such as the American College of Surgeons and AAST and all of those. But this is in a much more intimate environment where you actually can sit down and talk to them and pick their brain about, things that you might be working on, their experiences as well. And it was truly a one-of-a-kind experience.
So the size of the conference made the other participants more accessible, it sounds like. Yeah. So what were some of the, obviously trauma is a huge topic to cover, but what were some of the themes that sort of stood out among the presentations?
So ones that were of most interest to me, just based on what I'm doing here in Santa Cruz with developing the trauma and emergency response system and also having a degree in public health, were the trauma systems and injury prevention talks, which we had people like Dr. Charlie Mock, Dr. Raul Coimbra, and other experts as well speaking to us about that. Then we also had disaster sessions as well. So Dr. Susan Briggs from MGH was here, Dr. Mark DeMoya from MGH. We're all talking about disaster response and how to prepare. And then there were also specific talks about like abdominal trauma and thoracic trauma, and people like Dr. Jean Moore from University of Colorado, and we had Dr. Tom Scalia from shock trauma. All of these amazing leaders were here talking to us in these small sessions. That was pretty incredible. It was kind of almost surreal to be here in Bolivia and have these people talking to us.
Yeah, you were there accidentally doing something else when the Congress came, right? So and there were some practical training sessions as well.
There were, yeah, and that's really one of the main aims of the Pan American Trauma Society, is not to just be about this once a year Congress, but to actually have these courses that then can possibly be offered year-round in these countries if we can, train the trainer and have people continue to offer them. And so there were courses both the day before the Congress started and the day after the Congress was. There were 4 the day before and 8 the day after. Both basic and advanced courses to disaster response, to basic trauma management, to quality improvement with trauma. So they really kind of, and I think also basic skills in like surgical trauma management as well. And so, things that are essential to be taught in this part of the world that really they lack a bit of access in getting to those. And so the Pan American Trauma Societies, one of their many goals is to deliver this type of training in a sustainable way in these environments.
Well, it looks like you were pretty impressed with the conference. And any last words you want to say about it?
I think I would just say that the Congress and then the society in general, I think, is fairly unique in that it brings together, like I said, people from trauma, from emergency care, from critical care, from acute care surgery, and also involves global health as well and public health. And so I really think that it's a society that kind of is as I say, mezcla, a mix of everything. And so I think, it offers something for everybody that's doing this type of work in Latin America, but also, or in anywhere in the Americas, but also outside of that region. And that I think, everybody that's a part of this Congress and society really wants to do bilateral exchanges and to really work on sustainability, to try to develop trauma and emergency systems across the world. And so I think that's probably what stuck with me the most, is just how dedicated all of the people that are in the society are and how unique this society is, and really has made me want to continue my involvement throughout my career.
Oh, yeah. Where is it going to be next year? You going to be there?
I hope so. Yeah. I go back to residency in June, so I'll ask my program director, but it's going to be in Maceió, Brazil, which is kind of in the northeast corner. It's a beach town, so that should be a huge draw. And it's in collaboration with a big trauma society there. It's their annual meeting as well. I don't know how to say it, but it's SBATE, which is the Brazilian Society, something about integrated trauma care. And so it's both the Pan Americans and their annual meeting. I think it's November 8th to 12th. So
okay.
I'll hopefully be presenting our work from this year, what I'm doing here in Santa Cruz.
Which can be seen on another video. So
yes,
everybody check that out. Great.
Yes, thank you.
Thanks for talking again, Dr. Boeck. Take care.
Thank you.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.